Okay. So remember when we dissected the brain?
Yes.
And remember I said that it had a covering over it, but when they prepared it for dissection, they removed it. Well, that covering was called the dura mater, right? And the dura mater is part of the meninges. So what it's saying here, we have two protected coverings. The outer covering is going to be the skull, right, the bone. And then the inner covering is the meninges. Okay, so the outer covering is going to be the skull, and the inner covering is the meninges. So the dura mater is the outer layer of the meninges, and the inner periosteum of the cranial bones or the skull. Okay, so the brain will lie in the skull, and this dura mater is going to cover the brain, and it's also going to connect to the inside of the skull. Okay. The dura mater is very, very tough. Okay, it's very hard. And excuse me, and its big job is to protect the brain. Okay, that's a big job. So I want you to know that we have 3 meninges. Did everyone sign this? Okay. We have 3 meninges. We have the most superficial, which is going to be the dura mater, right? And then we have the arachnoid mater, which is in the middle. And that's going to be, the reason we call it arachnoid is because it's a spider web-like layer. So we call it the arachnoid mater. So arachnoid mater will be the middle layer, and the pia mater is going to be the innermost layer. Okay, pia mater is the innermost layer. So if I ask you on a quiz or an exam, name the meninges from most superficial to deep. What are you going to tell me? Dura mater, arachnoid, and pia. So you can remember the word DAP. Okay, most superficial to deep would be DAP. If I ask you to name the meninges from the most deep to the most superficial, you can remember the word PAD, because you're going to start with pia, arachnoid, and then dura. Super easy, right? And arachnoid's always in the middle, so you can't miss that, right? So the pia mater adheres to the outer surface of the brain and spinal cord, and that's where all the blood vessels are, is in the pia mater, which stands to reason because it's the innermost layer. So spaces between and around the meninges. Okay, I do want you to know these because these are they're of clinical significance. So we have the epidural space, which is located immediately outside the dura mater, and then we have the subdural space, which is located between the dura mater and the arachnoid mater. Okay, I want you to know for the subdural space, it's the most common type of hematoma. The most common type of hematoma. You know what a hematoma is? Okay. For cases like this, is extremely serious because what it is, it's a brain bleed. So let's say you have a patient that falls and they hit their head, say on the corner of the seat, but they feel fine. You know, they get up and they're laughing and they're saying, oh, you know, I'm so clumsy, right? Well, what can happen? Within a few minutes, maybe an hour, they get this excruciating headache, right? Sometimes if they have treatment right then, I mean, if they go to the hospital and we can diagnose it quick enough, they will survive. But other times, they don't. It depends on how fast that the bleed is. A colleague of mine, her father fell and hit his head, and he was fine for 2.5 weeks. And then he told his daughter that he had a severe headache, and they took him in and he had a really slow bleed. But if they hadn't taken him in, he would have died. Okay, so it's very serious. I tell everyone, not just my patients, but everyone, if you hit your head, go get it checked out. It's better to be safe than sorry. And most of the time when we lose patients to these hematomas, it's because they thought nothing was wrong. They thought, oh, it was no big deal. Do you know Liam Neeson, the actor? Yeah. Well, his wife was on the money slip with their kids, and she fell, and she was laughing the entire time, and, you know, they came out and checked her out, and she said, oh, I'm fine. And she died. She died within hours. I mean, she went into coma and died. So, it's what? No, it wasn't that long ago. Subarachnoid space is located under the arachnoid and outside the pia mater. Okay. So, something else I want you to know is, remember when we talked about cerebral spinal fluid? Okay, where did I say cerebral spinal fluid was located? In the ventricles. In the ventricles. So what I'm going to have you do, I want you to be able to trace cerebral spinal fluid, where it goes, and I'll show you. So out of the 3 spaces between the meninges, there's only one that contains a significant amount of cerebral spinal fluid, and that's the subarachnoid space. I want you to know that. The subarachnoid space contains a lot of cerebral spinal fluid.
Is that what they remove, like, not remove, but like pull out to check to see if like somebody has CP or like other?
Yeah, when they do a spinal tap?
Yeah.
Uh-huh. So this is what I want. I want you to know what the function is of cerebral spinal fluid. It provides a supportive, protective cushion. Okay, I want you to know that. And you already know that cerebral spinal fluid is found in the ventricles or the cavities within the brain and spinal cord, and it's found in the subarachnoid space. You already know that, right? So if I ask you, where do we find cerebral spinal fluid? You're going to tell me in the subarachnoid spaces and the ventricles. So remember our ventricles, we have 4 large fluid-filled spaces within the brain. First and second ventricles are lateral, third ventricle, and then the fourth ventricle. Okay, so 1 and 2, we say lateral ventricle. I want you to know where they're located. So the first and second ventricles, or lateral ventricle, is located in the corpus callosum, that rubber band-like structure that we saw in the brain. ventricle is located right underneath the corpus callosum. And the fourth ventricle is located, do you remember?
The cerebellum.
In the cerebellum, the little brain.
I was showing my daughter the picture when you biopsy, so when you were showing us the brain and lab, she was
Oh, was she?
she's like, oh, that's so cool, that's so messy. I'm like,
Okay, so for cerebrospinal fluid, I want you to write down what I said, okay? Cerebrospinal fluid goes from the lateral ventricle and seeps into the third ventricle. Okay, that makes sense, right? This lateral ventricle is in the corpus callosum. Right under the corpus callosum, we're gonna find the third ventricle. So fluid from the lateral ventricle seeps into the third ventricle. From the third ventricle, it's going to go to the fourth ventricle. This isn't really hard, right? Okay? So it goes from the lateral ventricle to the third ventricle to the fourth ventricle. From the fourth ventricle, it's going to go to two different areas. It's going to go to the subarachnoid space, and then from there, it's going to be absorbed into the venous blood through the arachnoid villi. And villi is like that, it's like hair-like projections. That's all you have to know. So if I ask you the flow of cerebrospinal fluid, it's going to go from the lateral ventricle to the third ventricle to the fourth ventricle to the subarachnoid space. Okay? Okay. Structure of the spinal cord. It lies within the spinal cavity, you already know that. It extends from the foramen magnum. Where's the foramen magnum? It's that big hole where? Yeah, in the skull, right? Okay. To the lower border of the first lumbar vertebrae. It has two bulges, one in the cervical region, which is in the neck, and one in the lumbar region, which is lower back. All right. I want to talk to you a little bit about weight and brain matter. For the most part, the brain is made up of two types, white and gray. Where did we see the white matter? In the tree of life, in the cerebellum. So I want you to know the function of the white matter and the function of the gray matter. So the white matter transmits signals and mainly impacts how the brain functions and learns. So just think about that for a minute. The white matter is going to impact how the brain functions and learns. The gray matter helps route sensory and motor stimulus. Unfortunately, both areas are impacted when we have a migraine. Has anyone ever had a migraine in here? Anybody? It's a day out of your life, right?
So I've had some that last 3 days.
Oh my goodness. Yeah, so you know, I mean, you can't do anything, and this is why. It's affecting both the white and the gray matter of the brain. So, what we have learned, and I find this very interesting, and we're still studying, but migraines can cause white matter lesions on the brain. And this is what they look like. You see all these little white lesions here? These are all caused by migraines. These white matter lesions are identical to our patients that have MS. They also have these same white matter lesions. So we're trying to see like what the connection is, if there's any. But very interesting, for sure. Functions of the spinal cord. Okay, this is where you're really going to be upset.
Oh.
The spinal cord provides conduction routes to and from the brain. We have ascending and descending tracts. And tracts are like a group of nerves, so they're both structural and functional organizations of nerve fibers. Okay, that's where these the bundles of nerves lie in, if you will. So ascending tracts conduct impulses up to the brain and spinal cord. I want you to know that.
What is that?
Ascending tracts conduct impulses up the cord to the brain. Descending tracts conduct impulses down the cord from the brain. It makes sense. Descending, you just think going down. Okay, here's the good news. I'm not going to ask you the ascending tracts. Okay? We're only going to focus on the descending. Does that make it a little better? All right. It's the right better. Actually, I did lie a little. I know, I forgot that I did, and I'm only doing it because they may ask you this. So, you're gonna be responsible for 2 of the tracts for ascending. Okay, but just 2. Lateral spinothalamic and anterior spinothalamic. So here's what I want you to know. For the functions of the lateral spinothalamic tract, I want you to know that it includes crude touch, pain, and pressure. Crude touch, pain, and temperature. I said pressure, but I meant temperature. My bad. What's crude touch?
Physical?
Crude touch. Crude touch means, I hate to use this analogy, but have you ever had a spider on your back?
Unwanted touch.
I know, I hate this. So you feel something's on your back, but you can't actually pinpoint where, but you know it's there. That is crude touch, which is the opposite of discriminative touch, because discriminative touch, like if I put my finger here, I know exactly where I'm moving. Okay. I hate using that because I've tried to train my brain to think that spiders can't get on me at all. I know. The functions of the anterior spinothalamic tracts are crude touch and pressure. Okay, so lateral is going to be crude touch, pain, and temperature. And anterior is going to be crude touch and pressure. Okay, so they're both crude touch. But the lateral spinothalamic is pain and temperature, and anterior spinothalamic is crude touch and pressure. That's all I want you to know for ascending. Okay, you don't have to worry about anything else for ascending. Descending, unfortunately, you have to know them all. Okay, So what I will probably do for the quiz on Tuesday is just give you one track of what we're going to go over today, because it's only 20 questions, right? On the exam though, you're gonna have several questions about these tracks. Okay, so let's look out. The function of the lateral corticospinal tract is voluntary movements on the opposite side of the body. Voluntary movements on the opposite side of the body. So voluntary means what?
We thought about it today.
Yeah, we're doing it, right? So voluntary movements on the opposite side of the body. Voluntary movements on the same side of the body are the functions associated with the anterior corticospinal tract. So anterior is same side, lateral is opposite side. The function of the reticulospinal tracts is maintaining posture during movement. This is so important, I know, and this is why when our patients get older and they're suffering from degenerative disc disease or something like that, and they're kind of hunched over and they're trying to walk, it causes lots of issues. They're at a high risk for falling. So the function of this reticulospinal tract actually helps maintain posture during movement. It works fine unless we have a pathology. The functions of the rubrospinal tracts include transmitting impulses that coordinate body movements and maintenance of posture. We take all this for granted, right? Our patients that have MS, they lose all of this. Tectospinal tracts control head and neck movements during visual reflexes. The stibulospinal tracts control the coordination of posture and balance. The spinal cord is the reflex center for all spinal reflexes. Spinal reflex centers are located in the gray matter of the cord. Okay, you don't have to worry about that last one, but I want you to know all of these tracks. I'm not a big fan of flashcards, but in this case, I wouldn't be upset if you used them for this. Okay. Okay, for the brain, I want you to know we have 6 divisions. I promise I'm going to test you on this, so please know it. If I ask you how many divisions of the brain do we have, you're going to tell me 6. And they are the medulla oblongata, the pons. Out of the 2, which one's closest to the brain stem? You got it. Because M comes before P, right? Okay. Midbrain, cerebellum, diencephalon, and I'll show you what the diencephalon is in there. And the cerebrum. What's the cerebrum? The big brain, right? The big brain. I want you to know that most of the time we refer to the medulla oblongata, the pons, and the midbrain as the brainstem. The medulla oblongata, the pons, and the midbrain we refer to as the brainstem, all of those. So brain development, most new neurons are produced before and shortly after birth. The brain is one of the largest organs in the body, and it has over 100 billion neurons and glia. Over 100 billion. Synapses are made and broken throughout life. The process of prenatal development is referred to as embryology. Embryology. there are three primary germ layers. Three primary germ layers of the growing embryo. The brain develops from the ectoderm, and that's going to be the outermost layer of the three primary germ layers. And then we have mesoderm, which is the middle layer. Mesoderm. That's easy to remember because mesoderm starts with an M, so does middle. And then endoderm. Endoderm is going to be the deepest layer. From these germ layers, we have a neural tube that eventually forms. And this neural tube will develop into the brain and spinal cord. So what's really great now is that if your patient's pregnant and we discover that she has a neural tube defect, we can fix it in utero. In most cases now, which is amazing. Because before, we didn't have that ability, so the baby would be born with spina bifida, you know, all kinds of terrible things. Some they didn't recover from. So it's amazing what we can do now with prenatal care. Diencephalon, I want you to know that the thalamus, the optic chiasm, and the hypothalamus are all located within that diencephalon. 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 So you want to think of the thalamus, optic chiasm, hypothalamus. Do you remember what the optic chiasm does? It was that little, remember I told you try to think of it as an X? And what came out of it? Optic nerve, the optic nerve. And what was the little hole right below it? Do you remember that? It started with an I? Yeah, infundibulum. And if it was still there, what was hanging from it? Pituitary gland, which is the master gland. Okay, good. Just a little review there. Cerebellum is the second largest part of the brain. We refer to it as the little brain. It contains more neurons than the rest of the nervous system. We've already talked about arbor vitae. It's the white matter. It's the tree of life. That's all I want you to know there. Functions of the cerebellum compares motor commands of the cerebrum with proprioceptor information. What's proprioception? Do you remember what proprioception is? Proprioception is our ability to be aware of our body parts. Like for instance, if I turned all the lights out and it was completely dark, you couldn't see anything, you would know that you were still sitting. If you stood up, you would know that you were standing, even though you can't see anything. If you put your arm up in the air, you would know that your arm was up in the air. That's proprioception. So the cerebellum acts with the cerebral cortex to produce skilled movements. It controls skeletal muscles to maintain balance. It controls posture, and it processes sensory information. What about cardiac? Does it control cardiac function? I got that in purple.
The heart is a muscle.
Okay, I like what you're thinking there. What do you think? patient that has a, brainstem stroke. Okay. What's the prognosis? Poor. Very, very poor. They almost never recover 100% if they even survive. Okay. So what did I say? When we think of the brainstem, what's the three structures that we think of? The pons. Yes, the midbrain, the pons, the medulla oblongata. The cerebellum really does not control cardiac function. It's going to be what? Things like the brainstem and the pons and the medulla oblongata. Oh, let's see. Okay. I'm gonna skip a little bit of this. Diencephalon, main components are the thalamus and the hypothalamus. What else was in there I showed you? Optic chiasm?
Yeah, and the hypothalamus.
Okay. The pineal gland is in there as well, so you wanna make note of that, makes up the diencephalon. What's the pineal gland? What's its claim to fame? It regulates our circadian rhythms, which means it does what? What hormone does it secrete? Yeah, secretes melatonin. Okay. I want you to know slide 34 really well. The primary functions of the thalamus. So it plays two parts in the mechanism responsible for sensations. It plays a part in the mechanism responsible for emotions by associating sensory impulses with feelings of pleasantness and unpleasantness. Plays a part in the arousal mechanism and plays a part in mechanisms that produce complex reflex movements. I want you to know that this is like a select all dot plot. Select all dot plot. And of course, I want you to know the functions of the hypothalamus. We already knew from last semester what's the big function. It's our body's thermostat. It's our body's thermostat, temperature regulator. I want you to know it's a major relay station between the cerebral cortex and lower autonomic centers. And one big thing it does, it synthesizes hormones. So it synthesizes hormone secretion by the posterior pituitary, and we're going to talk about this posterior pituitary when we talk about the endocrine system, and plays an essential role in maintaining water balance. So I want you to know it synthesizes hormones, it helps maintain water balance. I also want you to know it's where our thirst and appetite center is. Thirst and appetite center is in the hypothalamus. Yeah. And you want to know it's the body's thermostat. Okay? I'm going to have more functions when we get to the endocrine system. But if you can remember those, I'll be really happy. Okay? Body's thermostat, synthesizes hormones, maintains water balance, and the appetite and thirst center is there. Let's do one more, and I think we're gonna have to finish in the lab. Doesn't it end at 10:30? This guy?
Yeah.
Okay. Let's see. You already know this. The hypothalamus plays a crucial part of the mechanism of regulating appetite and maintaining normal body temperature. Pineal gland, we already know, I already told you. It regulates some circadian rhythms. It secretes a hormone called melatonin, and it's also, the hypothalamus actually controls the pineal gland. So that's another function of the hypothalamus. I want you to know that melatonin is made from the neurotransmitter serotonin. And melatonin is known as the sleep hormone. I call it the Dracula hormone, because it only comes out at night. Unless you're on shift work, and then eventually it changes. And then when it changes, they put you back on that shift.
Yeah, they did.
And that's what happens. So we talked about, when we dissected the brain, the frontal lobe, the parietal, temporal, occipital. And this is a very general function list of each lobe. What you will see, no matter what picture you're looking at, is that they kind of overlap each other, okay? But the frontal lobe, I want you to think of thinking, planning, short-term memory, things like that in the frontal lobe. Parietal lobe, you want to think of touch, smell, taste. Temporal lobe is where a lot of our memories are, but as you will see, it will overlap. Occipital lobe, I want you to think of visual. Okay. Occipital lobe, vision. And we do one more. The limbic system is also known as the emotional brain. I want you to know that. If I ask you, what is the emotional brain called? You're going to tell me the limbic system. And that's anger, fear, sorrow. Memory is one of our major mental activities, and the limbic system plays a key role in memory. And again, as I said, temporal, parietal, and occipital lobes are among the areas responsible for short and long-term memories. I'm not going to test you on this, but I wanted to bring this to your attention. The hippocampus right here, this area right here, if we have a patient that is suffering from Alzheimer's, this hippocampus is severely compromised right here. Sometimes it starts out real slow, so you don't see a lot of changes at first, but as it starts to deteriorate and the disease progresses, eventually the patient can't remember to swallow. They forget how to swallow. That's how it gets at the end. Okay. We'll stop here. You want to start the lab in 10 minutes? 20 yards? Is that good? What about the reviews? We're going to do it all, right?
So we're all lab today?
I think we just need to do a review. I think we can do the review part.
Oh, can we?
Huh? Review part for all the stuff I think is gonna do in here.
Let me see.